Welcome back. Today we're breaking the silence around sexually transmitted infections, STIs. Sexual health is just as important as physical or mental health. Being informed helps you make safer choices for yourself and your partners. We'll cover the most common STIs, media group, medical diagram of human body, doctor pointing to STI chart, close-up of lab test tubes labeled chlamydia, gonorrhea, syphilis, add stock, distribute _equally, chlamydia, gonorrhea, syphilis, HPV, herpes, HIV, and trichomoniasis. You'll learn what they are, how they spread, symptoms, and how to prevent and treat them. Let's replace fear with facts and empower ourselves. Ready? Let's dive in. First up, chlamydia, one of the most common bacterial STIs, affecting millions of people worldwide every year, especially those under 25. It's a major public health concern, but many people don't even realize they have it. It's often called the silent infection because most people have no symptoms but can still spread it to others without knowing. You can feel perfectly healthy and still carry the bacteria, which is why it's so important to be aware. Chlamydia is transmitted through unprotected vaginal, anal, or oral sex, and can also be passed from parent to baby during childbirth. Anyone who is sexually active can get chlamydia regardless of gender or sexual orientation. That's why prenatal screening is so important. Pregnant people should always be tested, because untreated chlamydia can cause serious complications for both the parent and the baby, including premature birth or eye infections in newborns. If symptoms do appear, women may notice unusual vaginal discharge, pain when urinating, bleeding between periods, or pain during sex. These symptoms can be mild and easy to overlook. Men might see discharge from the penis, a burning sensation when urinating, or pain and swelling in one or both testicles. But again, most people don't notice anything at all. But remember, most people feel fine, so regular screening is key. The only way to know for sure if you have chlamydia is to get tested, even if you feel completely healthy. Untreated chlamydia can cause pelvic inflammatory disease, PID, in women, leading to chronic pain, infertility, or dangerous ectopic pregnancies. PID can develop silently and cause lasting damage before you even realize there's a problem. In men, it can cause pain, swelling, and rarely infertility if left untreated. It can also increase the risk of other infections, including HIV. The good news? Chlamydia is easily cured with antibiotics. Treatment is simple, effective, and usually involves just a short course of medication. A simple test and a short course of medication can protect your health and fertility. Getting treated also helps protect your partners and stops the spread in your community. Don't wait for symptoms. Get tested regularly if you're sexually active. Annual screening is recommended for everyone under 25 and for older adults with new or multiple partners. Early detection prevents serious complications. The sooner you know, the sooner you can take action and protect your future health. Protect yourself and your partners by staying informed and proactive. Open conversations about sexual health help break the stigma and encourage everyone to get tested. Regular screening is a small step with big benefits. It's quick, confidential, and can make a huge difference in your life. Take charge of your sexual health. Make testing a normal part of your routine just like any other health checkup. Prevention and early treatment are everything. Use protection, talk to your partners, and don't be afraid to ask your doctor questions. Don't let a silent infection catch you off guard. Being proactive is the best way to stay healthy and confident. Knowledge is your best defense. Stay safe, get tested, and encourage your friends to do the same. Let's move on. Next, gonorrhea, another common bacterial STI, often found alongside chlamydia. It spreads through unprotected sex and can infect the genitals, rectum, and throat. Many people have no symptoms, especially women. When symptoms do appear, they're similar to chlamydia: discharge, pain when urinating, or pelvic pain. Untreated, gonorrhea can cause PID in women and infertility in both sexes. Rarely it can spread through the bloodstream, causing joint pain or even life-threatening infections. Gonorrhea is curable, but antibiotic resistance is rising, so proper diagnosis and treatment are crucial. If you're treated for chlamydia, you'll likely be treated for gonorrhea too. Regular testing and prompt treatment protect your health and prevent complications. Don't ignore subtle symptoms. Get checked. Safe sex and regular screening are your best protection. Take action early. Let's keep going. Now let's talk about syphilis, a historic sexually transmitted infection that's making a surprising comeback in recent years. Once thought to be nearly eradicated, syphilis is now on the rise again, affecting people of all backgrounds and ages. Syphilis is often called the Great Pretender, because its symptoms can easily be mistaken for other illnesses. This makes it tricky to diagnose without proper testing, and many people don't realize they have it until it's advanced. The infection spreads through direct contact with syphilis sores during vaginal, anal, or oral sex. It can also be passed from a pregnant person to their baby, which can lead to serious health problems for newborns. Syphilis develops in stages. The first stage is marked by a painless sore, called a chancre, which appears at the site of infection, often unnoticed and healing on its own. Next comes the secondary stage, which can bring rashes, especially on the palms and soles, along with flu-like symptoms such as fever, sore throat, and swollen glands. After these symptoms fade, syphilis enters a hidden or latent phase. During this time, a person may feel completely healthy, but the infection is still present and can last for years without any signs. If left untreated, syphilis can progress to the late or tertiary stage, causing severe and permanent damage to the brain, heart, nerves, and other organs, even decades after the initial infection. Complications like neurosyphilis and ocular syphilis can develop, leading to paralysis, blindness, dementia, or even death in extreme cases. The good news is that syphilis is completely curable with antibiotics, especially if it's caught early. Early detection makes treatment simple and highly effective. For most people, a single shot of penicillin is all it takes to cure early syphilis. More advanced cases may need additional doses, but treatment is still possible. Remember, early treatment can prevent permanent damage, but it can't undo harm that's already been done. That's why timely diagnosis is so important. Regular screening is vital, especially for those at higher risk, such as people with multiple partners, men who have sex with men, or anyone with a partner who is tested positive. Don't let syphilis go unnoticed. Get tested regularly, even if you feel fine. Early detection protects you and those you care about. Protect yourself and your partners by practicing safer sex, using condoms, and having open conversations about sexual health. Knowledge and action save lives. Stay aware, stay healthy, and help spread the word about syphilis prevention. Prevention and early treatment are key. Don't wait for symptoms. Be proactive about your health. Let's talk about HPV next. Moving on. HPV, human papillomavirus, is the most common sexually transmitted infection worldwide, affecting millions of people every year regardless of age, gender, or background. In fact, nearly everyone who is sexually active will get HPV at some point in their lives, often without even knowing it. Most HPV infections are harmless and clear up on their own thanks to the body's immune system. But some types of HPV can linger and cause health problems, including genital warts or, more seriously, cancer. High-risk strains of HPV are responsible for nearly all cases of cervical cancer and can also lead to cancers of the anus, penis, vulva, vagina, and even the throat. The HPV vaccine is a true game-changer in public health. It protects against the most dangerous cancer-causing types of HPV, dramatically reducing the risk of developing these cancers later in life. Experts recommend vaccination for preteens, ideally before any exposure to the virus, but it's never too late to ask about it. The vaccine can be given up to age 26, and in some cases even up to age 45. Even if you've been vaccinated, regular Pap smears and HPV tests are essential. These screenings help catch abnormal changes early, when they're easiest to treat. It's important to remember that HPV isn't just a women's issue. Men can get HPV and develop related cancers too. This virus truly affects everyone. Practicing safe sex, like using condoms and dental dams, can lower your risk. But HPV can still spread through skin-to-skin contact, even when there are no symptoms. That's why vaccination and regular screening are your best defenses against HPV-related cancers and complications. Talk openly with your doctor about the HPV vaccine and the right testing schedule for you. Taking these steps can make a real difference in your long-term health. By protecting yourself, you're also helping to protect your loved ones and your community. Don't let myths or misinformation keep you from getting vaccinated. The facts are clear. The HPV vaccine is safe, effective, and saves lives. Take charge of your health by making informed choices, staying active, and eating well. HPV is incredibly common, but with the right knowledge and prevention, cancer doesn't have to be. Stay informed, stay protected. Next up, herpes. Herpes is caused by two viruses, HSV1 and HSV2. HSV1 usually causes cold sores but can also cause genital herpes. HSV2 mainly affects the genitals. Both are lifelong infections and can be spread even without visible sores. Many people have mild or no symptoms, so they may not know they're infected. Outbreaks cause painful blisters, but most people have fewer outbreaks over time. Antiviral medications help manage symptoms and reduce transmission risk. Daily medication can prevent outbreaks and protect partners. Herpes doesn't affect fertility or cause cancer. Stigma is often worse than the infection itself. Open communication is key. Condoms lower risk but aren't foolproof. Herpes is common and manageable. You can live a full, healthy life with it. Let's talk about HIV. HIV changed the world, but today it's a manageable condition. HIV attacks the immune system and if untreated can lead to AIDS. It spreads through blood, semen, vaginal fluids, rectal fluids, and breast milk, not through casual contact. Early symptoms may feel like the flu, but many people have no symptoms for years. Untreated HIV weakens the immune system, leading to life-threatening infections. Modern treatment, antiretroviral therapy, ART, controls the virus and lets people live long, healthy lives. ART reduces the virus to undetectable levels, meaning it can't be sexually transmitted. U=U. Prevention tools like PrEP and PEP are highly effective. Regular testing, safe sex, and not sharing needles are key to prevention. HIV is no longer a death sentence. Early diagnosis and treatment change everything. Stigma is still a barrier. Let's break it down with facts. Take charge of your health, get tested, get treated, stay healthy. Science has changed the story. Next, trichomoniasis. Trichomoniasis is the most common curable STI caused by a tiny parasite. It spreads through sexual contact, mostly affecting the vagina or urethra. Most people, especially men, have no symptoms. Women may notice itching, burning, or unusual discharge with a fishy smell. Untreated, it can cause pregnancy complications and increase HIV risk. Diagnosis is simple, a quick test at the doctor's office. It's easily cured with a single dose of antibiotics. All partners should be treated to prevent reinfection. Wait a week after treatment before having sex again. Regular screening is important, especially for women. Don't ignore symptoms, get checked. Prevention and early treatment keep you healthy. Let's wrap up. That's our overview of the most common STIs. Knowledge is your best defense. Understand risks, symptoms, and prevention. Practice safer sex and get regular screenings. Talk openly with your partners and your doctor. Don't let stigma stop you from taking care of your health. Share this video to help others stay informed. Thanks for watching. Subscribe for more health tips. Stay safe, stay healthy, and see you next time.